think about healthcare, you might first think about the expensive acute care that we read about in the headlines. But if you ask family physicians, they'll tell you that 90% of your healthcare is in the community. But really, who provides almost all of your healthcare? It's not doctors, it's not nurses or other healthcare providers like me. It's you. Real healthcare is self-care. The best predictor of your future health are the habits you practice today. So the 4 foundations of good self-care are what you eat, what you do, how you feel, and how you relate. What do you put into your body, both healthy and unhealthy things? What do you do with your body? Physical activity that supports all the activities of daily living and helps you do what's meaningful for you. How do you relate to other people? How do you connect? At home, work, in school, and with society. And finally, how do you feel? How do you recognize your emotions and how do you manage them? And how do you live a meaningful life? The doctors who compose the divisions of family practice care for our patients in our practices, care for you individually, but now care for our community as a whole. And we're involved in other stakeholders in providing the best healthcare that you can have and to make you the best self-care provider. Let's talk about important gastrointestinal symptoms. So the gastrointestinal system. Do you have difficulty swallowing? So I ask this of my patients. It's to see if anything might be stuck in their throat or esophagus. So if food seems to be getting stuck recurrently at the same level, that could be a sign of some narrowing of the esophagus or an obstruction that we need to check out. So that is not normal. And do you have heartburn? So that's the sensation of acid coming up into the chest, often confused with angina as well. So that's a burning sensation in the throat or the chest. Often it's from just fluid coming up from the abdomen, gastroesophageal reflux. It could be just the reflux and not the acid, or it could be from the acid itself. It could also be from drinking too much alcohol. And a lot of our medication that we prescribe do cause heartburn or acid reflux as well. And have you been vomiting? So frequent and recurrent vomiting could be a symptom of bulimia, where it's more intentional. It could be due to an infection where you're feeling a lot of nausea or gastrointestinal disorder. It could be due to a blood imbalance of your electrolytes. It could be due to gallstones with a gallbladder, or something else involved in the abdomen, causing compression and change in your gastrointestinal system. And of course, nausea is a common symptom of pregnancy and often associated with migraine headaches. So what are you vomiting? So if you have vomiting blood, that could be from a bleeding nose, but it could also be from a bleeding ulcer. And in people that have been drinking very heavily, they develop varicose veins, varices in their esophagus, and those could be ruptured by vomiting too. And that's a very serious emergency. Has anyone ever seen coffee grounds in the toilet bowl? So if you throw up coffee grounds, that's a classic sign of a bleeding ulcer. So you have to go to the emergency right away, 911. So my father-in-law had that, and we got him looked after right away, and he did have a bleeding ulcer. So we saved his life again. So if you ever see coffee grounds that you throw up, that's abnormal unless you actually did eat the coffee grounds. And then you should still see your doctor, because that's not normal either. Have you had an increase in gas? So an increase in gas could be just due to changes in your diet. So fiber that we want you to have from fruits and whole grains, those are great, but that's the part of the food we don't absorb. So if you're trying to be healthy, increasing your fiber, you might have harder, drier stools, you might get more gas, and that's kind of natural, normal. And you just adjust your fiber and to see if it totally resolves. It could be due to intolerance, like lactose intolerance, where you're not digesting the cow's milk. So if you have that whipped cream and the ice cream and a big glass of milk and a milkshake, and then you're really bloating and passing gas, then you might be lactose intolerant. So check it with your doctor. You could go lactose free and see how you feel. And you probably shouldn't have that milkshake when you go for a date, if it's someone new. And then just fatty food. We don't absorb fatty food that well unless you eat fatty food all the time. But I eat a pretty low-fat diet, so if I have a restaurant meal or have a Chinese banquet meal, then I'm going to have more gas because I'm not going to absorb all that fat, which is good, then I won't get as fat. It could also be due to constipation, because what happens when you're holding your stools for a couple of days, the stools get harder and the stools ferment and they produce more gas. So the more delayed your bowel movement, the more likely you're going to have more gas. So So that's why you might feel bloated and gassy when you're constipated. But it could also be due to a bowel obstruction. If you've had surgery or there's a tumor or a growth, there could be scar tissue or something blocking your intestine that's causing a backing up and producing more gas pain. So something steadily getting worse, not so much related to diet, or with a significant change in your frequency of bowel movements. That's something you need to check out, like very soon. And have you had a change in the appearance or the frequency of the stools? Are your stools flattened all the time or pencil thin when they used to be normal? So that could be a sign of something compressing the bowel, either within the lumen of the colon, like a tumor or a polyp, or it could be like an ovarian mass that's pushing on part of the bowel, or a really large prostate that could push on the colon as well. So if there's a change in the shape of the stools, we'll take your word for it. You don't have to bring a picture. But we want to check that out. So there's been a change, make sure you report it. And has there been a change in the frequency of the bowel movement? So constipation is where you have a decreased stool frequency. It's a change from your normal. So it's often associated when you have to strain and you feel a little bit more gassy and harder stools. And then diarrhea is the opposite, looser, more frequent stools. And of course, has there been blood in your stools? So that's why you look before you flush. And the older we get, the more important it is. So when we're younger and we're straining and we have a hemorrhoid, it might be okay to see blood in the toilet paper. But as we get closer to 40 or 50, if you see blood in the toilet, recurrently you should check it out with a doctor. So we do check the stools after age 50, as I'll mention later, looking for blood in the stool, because that could be a sign of a polyp. Most of the time it's nothing, but it's a very early indicator. And then the next step would be seeing a surgeon or a gastroenterologist to put up a very skinny camera, skinnier than your stools, to actually check out to make sure it's not due to a polyp or due to a tumor. Does everyone know what melena is? So most people don't. Even actually the medical students I talked to today, I was teaching this afternoon, didn't know what melena was either. So it sounds like a very pretty girl's name. So if you do Google images, you'll get all these pretty girls, most of them of Mediterranean extract. But eventually you'll see this, and this is what we think about. Black tarry stools. So melena, this is why doctors do not name their daughters melena, because melena to us is digested blood from a bleeding ulcer. So that's what it looks like. It looks like black tarry stools. It's not pretty, not like that. It looks like that. So if you see it as black as our stethoscopes, as black as my jacket, and tarry, and often very, well, smellier than usual, you don't have to bring it to the office. You could take a picture. But we'll definitely check it out. And usually that's an emergency. If you pass that, you should go to the emergency. So black tarry stools caused by digested blood from a bleeding ulcer.